Welcome back. Did you know that 1 in 8 women in the United States will develop invasive breast cancer in their lifetime? But at the Tansey Breast Center at Ochsner, they're working to detect and treat breast disease quickly and in their state-of-the-art facility. Joining us now are Dr. Blakely Cute, an oncologist and hematologist, and Dr. Amy Mackey, a breast surgery oncologist, who both work at the breast center. I mean, thank you all for being here today.
Thanks for having us.
Now, this is something near and dear to me because my mother had breast cancer. So, and I know it's total different treatment now. But what should a lady do when they're sitting in the office and they hear, you have to go see an oncologist, there may be something there? What's the first thing that they should do?
Take a deep breath, because nowadays breast cancer actually does very, very well. We have really, really great treatments available for patients, and so it's sort of, you know, we have them come in and we have a long discussion with them going over all the different options available to them, and the odds are that they're actually going to do very well.
So if they get that diagnosis, what should they expect when they come to see you all at the center? What's the procedures? What's the steps to go through?
So lots of times they're having a biopsy first, so they've already done that. So then the next step is oftentimes meeting with the breast surgeon. And when they meet with the breast surgeon, they go over all of kind of surgical options.
Yep.
And then they'll kind of guide them in the pathway of, do they need to see a medical oncologist or do they need to see a radiation oncologist? But usually your first kind of point is meeting with a breast surgeon.
Yeah. And we spend usually about an hour with them in the office, kind of talking to them about the surgical options. We also kind of briefly touch on the medical oncology options, whether or not radiation may play a role in that, and then sort of going over what the next few months are going to look like for them.
Sure. And I know there are different risks for different ages and lifestyles. And what are some of the different risks that are something that folks maybe can do to help themselves out or should look for?
Yeah, so there are lots of different risk factors for breast cancer. Some of them we can change and others we can't. So most people would assume that being female is one of the biggest risk factors. Males do get breast cancer, but about less than 1% of our breast cancers are male. Also, as we get older, our risk of breast cancer increases. There is also a hereditary or genetic component to some breast cancers, but an important thing is only about 10% or less of breast cancers are hereditary. So all those women who say I don't have a family history, still super important to get screened because they very well could have cancer too. So it's not all hereditary. Some of the other risk factors, lack of exercise, obesity, prolonged kind of combined postmenopausal hormone therapy can cause some changes. So maybe some of the things we can do?
Yeah, so I think some of the things that we can do that will sort of help lower some of those risks, you know, we talk to patients about having a healthy diet, exercising. Exercising alone has been shown to lower the risk of breast cancer. Don't smoke. Smoking's bad in general. Kind of limiting your alcohol intake. We typically say maybe under 1 drink a day. Let's see what else.
And I think at what, women should start getting mammograms about 40? Or should you do it earlier if it runs in the family?
Exactly. So we actually have rolled out a high-risk screening program that we're really trying to educate people about. So people who have a strong family history, they really should probably start getting screened earlier. Usually we try to capture them starting around the age of 30. They may not need to start imaging until a little bit after that, but we really should be trying to identify who those women are at high risk so that we can potentially implement things earlier. But in general, the average age to start would be starting at age 40, doing annual mammograms.
And being a man, I can't relate to this, but I've heard women say that sometimes the mammogram are painful, but this is something that's necessary.
Yes.
Because it's a lot worse if it's a little bit of pain compared to what could happen.
Yes.
Absolutely. So mammograms are helping us. I mean, we can ideally catch cancers very early. Sometimes if we catch it early, you know, we can avoid chemotherapy, can make the overall treatment process much easier if we can catch it earlier.
Now, you've got a gala coming up, don't you?
We do, yeah. The Moonlight Miracles, it's going to be at the Superdome every year. I think it's on November 8th.
Yes.
And it's a really, really fun event. Lots of people, lots of dancing. And it just sort of celebrates the Cancer Center and cancer survivors, and there's lots of patients there and lots of physicians.
So if people want to help out and support the center, they should get tickets for the
the gala.
Moonlight Gala.
Yep.
Whether they go or not.
Exactly.
Go have fun
Is there
and support
anything else
cancer.
that someone can do to support the center?
I mean, there's always different ways to help out. We have survivorship parties. We always need sort of extra equipment and extra resources. So if,
Absolutely.
we're always happy to have any help we can get in helping take care of our patients.
Well, I mean, it is such an important cause, and I mean, thank you, ladies, for doing all that you do.
Yeah.
Because I don't think you all get enough credit for.
Oh no, we think our patients deserve the credit.
yeah.
No, they're the fantastic ones.
Yeah.
Well, it's you all help keep us healthy.
Thank you.
Gang, to learn more about the detection and diagnosis of breast cancer, you can call Ochsner's Breast Center at 842-6406 or just log online to ochsner.org/breastcancer. Now don't forget, the Moonlight Miracles Gala is coming up on Friday, November 8th at the Mercedes-Benz Superdome, so you can actually be down on the field where the Saints play. You can get tickets at ochsner.org/moonlight. Now there's much more to come after the break, so please stay right here with us.